oral delivery of anti-diabetic peptides through the exploitation of FcRn-mediated nanosystems. Diabetes is a metabolic disease with worldwide prevalence which is increasing over the years. The main types of diabetes are type 1 diabetes, type 2 diabetes, and gestational diabetes. Type 1 diabetes is developed when the pancreas is unable to produce insulin, increasing the levels of glucose in the bloodstream. While type 2 diabetes is developed when the body cannot respond fully to insulin, leading also to impaired glucose tolerance. This pathology is associated to several complications, as stroke, blindness, heart attack, kidney failure, and amputation. Generally, the diabetes treatment requires frequent subcutaneous injections of anti-diabetic peptides which are associated to poor patient compliance. Type 2 diabetes, some anti-diabetic peptides can be administered by oral route, being exposed to the acidic pH and enzymatic activity of the stomach and the mucous layer of the small intestine. Nanomedicine's International Drug Delivery Group has explored FcRn-targeted nanosystems for oral delivery of anti-diabetics. These nanosystems are composed by a polymeric matrix which can have mucodiffusive properties, can be loaded with anti-diabetic peptides with hydrophilic or hydrophobic nature, and conjugated with engineered FcRn-targeted ligands with enhanced affinity to FcRn. The encapsulated anti-diabetic peptide will be protected from acidic conditions and released in a controlled and prolonged manner. By targeting FcRn, the nanosystem will be able to surpass the intestinal barrier and escape to lysosomal degradation. The binding occurs in a pH-dependent manner, being favorable at pH between 5 and 6.5. The FcRn-mediated transcytosis allows to escape to lysosomal degradation and the release of the nanosystems upon physiological pH. At preclinical validation, transgenic mice are used to orally administer the anti-diabetic peptides. In this way, it is possible to evaluate the decrease of glucose levels without having cross-species differences. In this sense, oral delivery of anti-diabetic peptides through the exploitation of FcRn-mediated nanosystems may then provide improved oral bioavailability of anti-diabetic peptides and manage diabetes.